Welcome, welcome my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, I have the team of the doctors, so you can definitely take the advantage and you can only WhatsApp me on 922681060. My dear friend, this is the series going on discussing the different complaints of the patient and how to diagnose that particular case as a clinical diagnosis or provisional diagnosis. So today, 32-year-old male patient come to the doctor and he is complaining. Rather, in this case, patient himself has not come. No, I'm sorry. Actually, his wife has taken to him and he was explaining that, see, my husband is having very severe pain on the left side of the abdomen since last 6 hours. We are trying the home remedies, something like phenyl and these things, but he is not getting warm water drinking. But by nothing, he is getting relief. He is little bit so restless that severe pain intermittently, getting the few minutes unbearable pain, say for example 10, 15, 20 minutes, he is actually grumbling or the rolling on the ground. He cannot sit even on the chair or cannot lie down on the bed, and so restless he is. But we were just waiting for getting open of your dispensary, and now immediately, please doctor, see immediately what we should do. So actually it is already started since last 4-6 hours, but we are not understanding what to do, whether I should take the patient to the hospital or what I can do. Okay, just relax. Doctor is relaxing to the patient and doctor is asking again the confirmatory type of the question, the same complaint, but just repeatedly I can ask them whether your husband has a colicky or intermittent pain or is it a continuous pain. No, doctor. Actually, it is a type of the intermittent. It's not continuous, and it's very terrible. So I can say that it is a colicky pain. So immediately my mind starts thinking that the patient is having intermittent colicky pain in the abdomen. So it can be ureteric colic or large bowel colic. Actually, patient is complaining that particular pain on the what you can say right side. So there is no problem of appendicitis attack or appendicular colic, because appendix is always actually sorry, I'm sorry, the patient was complaining about the left side pain and the appendix is on the right side, so there is no issue of getting appendix in my mind. So pain is on the left side. Try to understand, pain is on the left side of the abdomen. Okay, I asked him that please just no doctor, I'm at the moment better, but I'm not sure again I can get the attack. Okay, but tell me my friend that this particular pain, whether it is spreading or going towards the penis or the testis, it is going like that, that you feel that pain is transforming or radiating to the penis or the testis. And also tell me whether you get any burning of the urination, difficulty in the urination. Yes, doctor, you are right. Doctor, you are right. Actually, since last 3-4 hours, I am always restless and want to go to the toilet. I want to continuous urge to pass the urine. Oh my God. So that means there is a pain and also intermittent spasmodic pain on the left side of the abdomen, and also he is having urinary problems. So this can be the ureteric colic because of the stone. My next question to the patient, did you have a loose motion or mucus from morning or yesterday? Any diarrhea type, mucus type in the stool? No, doctor, I don't have any problem with the stools. No, nothing. Then I have in my mind that there is no possibility or having the what you can say the condition like amoebic colitis or infective colitis, because he don't have any problems because of the stool. Okay. Now tell me, my friend, do you have the fever since last 2 days or today? No, doctor, I don't have any fever as such. No, my body is totally normal, is not having hot. Okay. So I don't feel that I am having the fever. So again, my mind thinks that it is having without fever. So it cannot be the urinary tract infection or UTI, because UTI always gives the fever with rigor and also burning micturition. Fever with rigor. So this patient don't have the fever. Okay. Next, my question might tell my friend that whether you are having vomiting last 3-4 days. Yes, doctor, I have 1 or 2 times like getting a little bit, but not too much. But yes, I had that particular vomiting. Okay. Then I have to think that patient is having a little bit provisional diagnosis is ureteric colic and he's having vomiting. So I must check whether he has any dehydration. So I start to palpate the abdomen, ask the patient to lie down, and gentle palpation has been started. Then I found that there was mild tenderness in the left iliac fossa. Mild tenderness, that means after am I touching, the patient grumble or scream. He's showing the face anxious. So that is tenderness. Mild tenderness I found in the left iliac fossa. And I also, when I check the renal angle from the back side, I found that there is also tenderness. So actually, you see that tenderness was very, very mild. Try to understand. It was not at all severe. If the tenderness is severe, then I must think about another provisional differential diagnosis, that is amoebic colitis or other causes of acute abdomen. He has very little tenderness as well as nothing. So because in ureteric colic, tenderness is not common. Try to understand. In renal or ureteric stone, tenderness is not common. Tenderness is common in amoebic colitis or acute abdomen. Acute abdomen is also called as a surgical abdomen. Sir, what is that acute abdomen? Acute abdomen means if there is inside something pathology like volvulus of the intestine, that means twisting of the intestine colon. If there is an intussusception, one part is entering into the other part of the lumen of the colon, that is called as intussusception. And third is a bleeding. So, or perforation, I can say. So perforation, then intussusception or the volvulus. These are the three important causes of acute abdomen. Patient must be admitted in the hospital and do the surgery. Okay. Now, if I am suspecting very strongly ureteric colic, then I must do some basic investigation immediately, that I will send the urine for getting the routine examination, physical, chemical, and microscopic. But in microscopic urine examination, there must be, I am saying must be RBCs, red blood cells, and their crystals will be abundant. Crystals abundant and RBC hematuria is suggesting of ureteric colic. Then one must can do the sonography, and KUB also can be done. So, but here the problem is, or you understand all the case of male patient. Suppose, imaginary, if this patient is a female patient and she is complaining of the left-sided pain, abdominal pain, then the doctor should ask about menstrual history, menstrual cycle history, and a gynecologist should also do the per vaginal examination, PV examination, and USG also important to rule out the ectopic pregnancy and twisted ovarian cyst. These are the differential diagnoses: ectopic pregnancy or twisted ovarian cyst. Okay. Now our diagnosis is confirmed that this is a left ureteric colic. Okay. So we have thought of amoebic colitis. In female, we have said that it can be thought of ruptured left ectopic twisted left ovarian cyst. Then what to do? Because we have to treat the patient. Of course, here I am not here to discuss all the what you can say the SOP, standing operating procedure for management, but just giving some hints. First, we have to give the immediate antispasmodic, very strong antispasmodic medicine. Few names I am telling you: injection anafortan, or this is intramuscular, or injection Fortwin can be given, or simple thing we do in our general medical practice, intravenous injection diclofenac, Voveron injection. This is giving the instant relief to the patient. Then injection atropine can be given. If the vomiting is more severe or the spasm is not coming down, then admit the patient and we can start, or in our daycare center, we can start intravenous fluids and hydrotherapy to flush the stone. Okay. Urine routine, as I have explained, X-ray, KUB, ultrasonography, this is in our hand. The most important last take home message: if the stone size is greater than 6 millimeter, if the ureteric or any size, because of the X-ray, because of the sonography, you get the size. If size is greater than 6 mm, then, or if there is a hydronephrosis, then best way, this patient should be tackled by urologist. So we can refer the patient, and urologist may give the different options of surgical management. So my dear friend, this was the interesting case which the husband has been brought to the clinic from the wife, or with the wife, because wife is stating that he is having severe spasmodic intermittent left side abdominal pain, and finally we have said that it is because of the ureteric colic. So my dear friend, this is all for this particular short video. We will continue to discuss such type of the simple complaints and their differential diagnosis and what we can do clinically, or what investigations we can do. My dear friends, all the best for you. Take care and see you in the next video. But don't forget to like and share this video, and don't forget to subscribe my YouTube channel to get the interesting videos like this. Okay. I wish all the best. Take care and see you soon. Thank you.